Hi there. I'm Shauna Butler. I am the host of it's COVID-19, the Orthopaedic Response. This is being produced in partnership with DOCSF, the DOCSF team, who has a fantastic conference that we produce every year in January. And our partners in that are UCSF. We're excited this year for this program to be joined by the American Academy of Surgeons. And they've really worked with us to be a global convener to address and rapidly respond to this dramatic change that we've seen within healthcare, that we've seen for our patients, for our communities. And we're really grateful to have a global audience help us think through how do we reimagine and reinvent in real time orthopedic care. So today, I'm really excited to have Jamey Edwards join us. And Jamey is this, he's on a mission to humanize healthcare. And the way he's been doing this is approaching telehealth as really, truly a way to democratize health and to remove the disparities. I first met and fell in love with Jamey, I have to be honest, fell in love with him with his focus on addressing the language barriers, the language needs. So many of us have been in a situation where we're taking care of somebody that the language that they are comfortable with and that they know is not the same one of the care team. And we all know how frustrating that is, even in your own language, when you can't communicate your needs and you can't communicate as a health professional to understand what's going on and how we can actually help. So Jamey, you have a lot of experience in this, and you've been working with thousands of institutions. And can you give me the volume of contacts and interactions that you've had through a telehealth platform?
Yeah, absolutely. Shauna, you keyed in on something really important, which is that communication is really the number one diagnostic tool that a provider has, but more importantly, the number one empowerment tool that a patient has. And so that's been a really core part of the mission here. And right now we're delivering that mission at over 1,200 hospitals, over 85,000 times a month on over 10,000 video endpoints nationwide. I think we're in 44 plus states right now.
I want you to that was a lot of numbers. Can you say those again I mean, that's huge.
Absolutely. So 85,000 encounters a month, 1,200 hospitals nationwide, plus federally qualified healthcare clinics and urgent care centers.
So you're touching a lot of people.
Yeah. I mean, it's pretty amazing. You go and you stand in the middle of our language center and you hear the people being helped every day in, 50 plus languages in video, 250 in audio. And you sit there and that's what gets me going. Whenever I need that little piece of rejuvenation, I just hop into one of the call centers and, perk myself up, if you will, knowing that those folks are on the front lines of care.
And when you said languages, let's talk about what those languages are.
Yeah, the languages, the top languages right now spoken across the United States, we have Spanish, Arabic, Cantonese, Mandarin. American Sign Language is obviously one that's critically delivered over the platform. Russian, and then you've got, languages from the folks that we serve in Hawaii, the Marshall Islanders type of languages. I mean, it really runs the gamut.
Well, I have been aware of the language barriers as a clinician from the standpoint of when I was working at Georgetown University Hospital. And so in DC, you have people come in and, oftentimes when I think people hear about what Cloudbreak Health is doing, they think about languages. Oh, I'm working with people who are in Italy, or I'm working with people. No, actually, the hospitals that I've worked in, we have to service people in 40 different languages.
That's right.
And for the last year and a half or so, I've been living in the Netherlands. I became keenly aware of, let me put it this way, I have been humbled. That's probably a better way to put it. And very mindful of how difficult it is when you can't get people to understand you, and also how difficult it is when you're trying to help people and you don't understand them.
Yeah, so, Shauna, right? Like you think about a hospital, it's scary enough when you speak English and your doctor's talking to you about.
And then they come in with the medical lingo,
myocardial infarction, and all these different types of things. And you're like, whoa. So imagine being in an ER. Yeah. You don't speak the language and people are rushing around, putting in lines, doing whatever it is, and you can't communicate with them. It's absolutely terrifying. And by the way, it's scary for the doctor and the nurse as well. You're sitting there trying to take care of someone and you care about this patient. You're trying to do the right thing, but they can't communicate with you to tell you where it hurts and what the issue is.
Yeah.
And so that causes a lot of anxiety.
And many of these words, sometimes you can pick up and they sound a little bit similar. But my favorite example of, do you know what the word nurse is in Dutch?
No, I don't.
I'm going to butcher it, but I'll give it a shot. Verpleegkunde.
Okay.
Doesn't
Doesn't
sound
sound like nurse to me.
Yeah, I wouldn't have gone there with nurse. So anyway, you've got a great
Replacement.
presentation because to help us from the standpoint of this dramatic change that we have seen with COVID-19. And in the orthopedic space, we're having to reinvent this all at once. And communication is key and being able to use these new tools. So let me have you go through your presentation
Okay,
and
great.
let's hear what you've got.
Yeah, so thanks to everyone who's watching right now. It's very honored to be a part of what DOCSF is trying to do here, which is bring people together in a time of need and help solve problems for everyone. And I think this is exactly the type of thing that we should be doing. So I'm here today to talk to you about telemedicine in the time of COVID-19. It's kind of like love in the time of cholera, but this is a critically important thing that we're doing, and telemedicine has clearly taken a center stage. So the interesting thing to note is the market was evolving pre-COVID-19. Our place-space relationship with our medical providers was already changing. The four walls of the hospital was breaking down. People were focusing more on value than they were on fee for service, and this shift was underway, but it was happening slowly. Healthcare is intrinsically a risk-averse environment, and there's a lot of revenue at stake for hospitals, et cetera, and the system itself. And so that change sometimes takes a little bit more time. And if COVID has taught us anything, it's that there's a catalyst to this innovation now that's really, really underway and affecting a lot of change very, very rapidly. And so, we're dealing with our hospitals all across the country right now on helping them solve what's in front of them and being very tactical, understanding that the tactical decisions we make now are going to have long-term benefits as we make this move from a digital transformation in healthcare from analog to digital. So I think the other important thing to note just at the bottom of the slide here is as patients become more engaged, on-demand healthcare is becoming an expectation. We're used to getting our food in real time. We're used to getting our audio and our entertainment and everything else on demand. Healthcare now is no different. So just to level set everyone, I've structured the presentation so that I'm going to kind of stay at 30 or 40,000 feet, but there will be instances when I dive down to provide some very, very tactical advice. But what is telemedicine? So telemedicine is the remote diagnosis and treatment of patients by means of communications technology. And there's a broad variety of those technologies that people use. And we will make sure to go over those technologies and show you what they all are. But one of the amazing things about it is really one of the benefits, allowing a clinician to practice and or a patient to be treated anytime, any place, and on any device. That is really what is going to make telemedicine work well is, again, this shift of the place-space relationship, but furthermore, the convenience, the satisfaction, and all of the benefits that it provides or the externalities that come from using telemedicine. And we're going to go over those in just a little bit. So I always get a kick out of this slide because we have a doctor seeing a patient over telemedicine, and at least the Jetsons thought that he was, needed the mask. And the great thing about telemedicine, and one of the things we can talk about is, there's a huge need right now for masks, PPE, and those things. So this became particularly relevant for this presentation. But those masks can actually be saved using telemedicine. And we have a use case that we've launched as a business that I'll go in later around telequarantine that actually protects frontline healthcare workers, reduces the use of PPE, so that we can keep those very, very scarce and important resources available for when they're needed. The other important thing just about this discussion is that telemedicine has been around for a long time, 30 or 40 years. Our first instance of telemedicine was picking the phone and calling our doctor. And then we started using email. But now with video and audio, and I'm going to go over the different types of telemedicine in just a second, we can deploy solutions to patients where they are and see them on their terms. So what happened? Along comes coronavirus. And with coronavirus, one of the things that really happened was the catalyzation of this digital transformation that we're going through right now. So first off, we had social distancing, and social distancing mandated that we really not be within 6 feet of each other. And while you can still communicate within 6 feet, in a clinical environment, it means something totally different. And clinical environments really aren't using social distancing, they're using what we're calling clinical distancing. And you can clinical distance by having telemedicine in a room and doing as much as you can for that patient remotely without being in their proximity and subjecting our frontline healthcare workers to risk of infection. And then we had shelter in place. And what shelter in place really drove in the healthcare system was people not going to the hospital. And so how do we see patients when they're not in the hospital? Telemedicine is obviously the perfect tool to do that, solving a real problem. And if you take a look at folks like American Well and other big providers of telemedicine networks in this country, their volumes have leaped 4 to 5 times over where they were before. We were talking to the team over at Ascension, and Ascension is doing thousands and thousands of teleconsults a day. And the team over there has done amazing work in onboarding thousands and thousands of physicians to see those patients. So there's a lot of change happening in a very short amount of time, and it's all triggered by what's happening with COVID, especially things like this. And we've all seen the memes as they go online. How do we protect those frontline healthcare workers? And this message of staying home, there are pros and cons to it. And one of the things that we're trying to look at right now is let's listen to the clinical advice of our leaders, which is stay at home. Most COVID cases are mild or moderate. So let's save those hospital resources for the people who have more of the moderate to severe cases that require physician intervention and ICU intervention. And so this messaging has really started to take hold with patients, and we realize that patients are listening because hospital volumes are actually going down as it currently stands. And the part of the hospital that's truly overwhelmed is the emergency department for these COVID patients and then the ICUs. But the other med surge part of it has all been shut down. There's no elective surgeries happening in hospitals today. All of that pre-surgery and post-surgery and all the thing that was happening before, it's simply not, all that stuff has been pushed off. And we worry about the patients who need chemotherapy and how we're going to deliver on that. And all of these, again, externalities that might happen from people saying, well, I need to stay home and I can't go out. But what about these patients that really need care? So telemedicine as an industry has been evolving. Initially, telemedicine 1.0 and 2.0 were really proving out use cases, especially in the B2C market. The B2B telemedicine market is very vibrant. I'll go into that in just a little bit, but uses like telestroke and telepsychiatry are being used nationwide every single day to save lives. But back then, hospitals were making very independent telemedicine decisions on their platforms. So they'd go out and they'd acquire technology through grants. They'd apply it to one specific use case, and no one was really thinking platform. Well, today in 2020, which we kind of ascribe to be this, the year of clarity, right? We're going to use the eye analogy on 2020 vision on what we can do here. People are moving to platforms and away from single use case solutions. And you want a platform because you can take and everything that a healthcare system has to offer and put it on a platform and bring that to bear and surround a patient with their care continuum. So that is the direction that things are going. It's telemedicine integrated as a routine part of care for the thousands of specialties that exist. So what does that landscape really look like? Well, there's different types of telemedicine, and this chart for me really sums up the whole market. You have asynchronous telemedicine, which is allowing people to time shift care the same way a DVR time shifts how you consume content online. You can take a picture of a mole and send that mole via text or email. You can, in a B2B environment, this would be the sharing of films by radiology groups for subspecialty reads. That's the asynchronous B2B aspect of this. On the synchronous side, it's real-time audio, real-time video. On the asynchronous side, it's AI and chatbots and things of that nature. So there's a lot of opportunity in a lot of different modalities out there, which I'll talk to in a second. The B2B market in our country, again, very vibrant. Specialists have been using specialty consults for a long time to serve underserved communities who weren't able to get that neurologist, who weren't able to get that psychiatrist to work at hospital A or live in that community. And so as a result, what do? You beam them in over telemedicine. And so that's been in use for a long time. There are a lot of companies that have built significant businesses serving that. And again, one of those things is language interpreters. It's what we do, in our service. And so we beam those certified medical interpreters to the point of care, and that's a great B2B use case. The B2C market is the one right now that is undergoing by far the highest volume increases and the most change. And again, that is very COVID driven. So in terms of modalities and tech stack, telemedicine is made up of a lot of different things. In our minds, we classically think about it as a telephone call or an audio visit, but it's actually made up of chat, AI, email, audio, video, image, and data sharing. And around that, you just can't have that video meeting room that we think about with GoToMeeting or WebEx. It's got to be something more. You've got to build a workflow around it, and you've got to make sure that telemedicine fits the workflow of how a clinician practices and how a patient wants to use it. So over and beyond that, there's things like remote patient monitoring as well that allows us to do things that were never conceivable before prior to this, including doing pulse ox and almost ICU level type of monitoring in a patient's home.
Jamey, on that point, I think it's
Yeah.
interesting. You mentioned remote monitoring. And I think that we've thought of these two things as separate activities. And really, this is an integration where the monitoring then feeds into. So the workflow, I mean, I think what you're describing has been, we've had a workflow that says we might do a virtual visit. And then we've had a
Yep.
workflow that is, let's remote monitor. This is where we need to have an integration of the remote monitoring and the virtual check-ins.
Absolutely. And like one thing leads to the other, right? If we're doing our job right, and we're talking to a partner right now who wants to roll out a strategy where they can basically do almost like ICU observation at home,
Mhm.
and use that to trigger a telemedicine call if a patient's, if the patient's data reaches a certain level and crosses a certain threshold, it triggers that telemedicine visit. So those are the types of things that you can do. And yeah, the walls are breaking down not only amongst all these modalities, and we're combining these solutions into the daily practice of how doctors are providing care, but the walls are breaking down between physicians, between hospitals, and everything is now kind of gray area, where before we would say, well, no, so-and-so can't do this because of XYZ reason. Where now we're saying, no, they actually can. And we could have a care team that we set up around a specific patient's comorbidities. So you might have a patient that has COVID, congestive heart failure, and diabetes, and that requires a certain skill and a certain team to be able to service that patient. And we can now set up those care teams remotely. And it might be a dietitian from NYU and a pediatrician from Children's Hospital of Orange County, all surrounding this patient who has a specific set of issues. But now you've got the best people in the country who can help treat that patient with the right knowledge and the right skill set at the right time. So what does it take to make telemedicine successful? From our experience, it's all about keeping it really, really simple. The UI UX, very Steve Jobs approach from our standpoint. Use what people already know and keep it simple. Allow them to push a button and get the resource that they need. While single specialty platforms are good, multi-specialty platforms are better. And the reason is a patient and a provider don't need to learn multiple systems in order to be successful. They can log into one app and they can get, an ortho consult, and they can get, that urgent care consult that they need all in one place. And that's really, really important. The more apps we have on our phone, the less likely they are to get used and the worse our adoption rates. So the more we can centralize these services in one experience, the better off that we'll be. And the same goes for our physicians as well. If they can do multiple specialties, if they know that they can take that, late night call from a patient on the same platform that they're also providing that B2B telehealth consult on, they're going to adopt that more into their workflow. One of the other things that we've tried to do is you want things to be private labeled, but the amazing thing about telemedicine is what gets measured gets managed. It's an old Peter Drucker phrase in the management world, and that's important because telemedicine, you've got start time, end time of calls. You're logging the chief complaint. You can actually do facial sentiment analysis on the provider and the patient to see how they're feeling at any point in time. And Shauna knows this better than anyone else from her exponential medicine, kind of background. There are real things that we can do to have the technology measure things, including having AI go and do a lot of this filtering around the different statistics that we're all tracking, and have it provide value to the physician as a clinical decision support tool. So, our goal is keep things simple, but what gets measured gets managed. Make sure you're tracking all the right data that you need to. Any device, anywhere, anytime is critically important now. We're in a world of bring your own device environments. And as opposed to us going out and pursuing proprietary software, we have decided that the iPad can do a lot of this heavy lifting for us. And it's, again, already a tool, the iPhone, the iPad, your Android device, already a tool that people are familiar with and know how to use. So we're seeing platforms move in that direction. And as opposed to coming out with proprietary closed-end platforms, we're seeing open-end platforms where really what we're trying to do is increase access to care. And we're all now walking around with supercomputers on our hips with these smartphones, which wasn't possible before, but now we can, and that smartphone can do a ton. And I'm going to show you some examples of what it can do a little bit later in the deck.
Jamey, while you were just on there, I was just going to comment that one of the reasons why this part is so important is that we oftentimes focus on the practice and the clinician setting this up and forgetting that on the other side, we have to make sure that we can't ask a group of individuals or patients to make sure that they've got this particular device. So
Correct.
are you Apple? Are you Android? Are you wearing it on your wrist? Are you looking at on a screen, on a laptop? So this part of the any device, anywhere, anytime is critical for the adoption rate for our end users, our patients, our beneficiaries.
Absolutely. And one of the things, it presents a real UI UX challenge, right, Shauna, to be able to make sure that you are viewable on every screen. But those are the types of things that telemedicine platforms are currently trying to address. It's not about putting up limits and saying, this is how you have to interact with us.
Right.
It's now companies saying, we're going to go to the patient where they are and interact with them on their terms.
Yeah.
Agreed. So again, workflow here is critically important. You don't want to be using a platform that forces you into a certain workflow. You want a platform that molds to yours, because as doctors, we really don't want to, you don't want to be commoditized. And so you want to be with a platform that actually supports your ability to practice the way that you practice, because that's what differentiates you from all other providers. And so having it happen in your brand and look and feel so that patients are familiar with it, having the workflow match what you do or what you think differentiates you. Again, critical part of the process. What you see here are two different companies with two very different workflows, but you can see that it's very easy to walk through them, and there's a step-by-step process. So there are certain things from a workflow standpoint that can be managed, but different use cases can be managed on one infrastructure, just with different workflows and different looks and feels. So what can you do with telemedicine? This is kind of the cool part where I highlight some people who I think are doing great things in the space. If you take a look at a company like CaptureProof, which is a company that's built a core competency in differentiating themselves on a computer vision standpoint and in asynchronous telemed, and as well, big player in the in the orthopedic space. These are the types of things that you can do, and hopefully the motion's coming through pretty clear on screen. But you can do range of motion analysis. You can do wound care. You can do all sorts of different things using AI and computer vision, just using your smartphone, and then putting that information in the cloud and letting the cloud do the heavy computing. So CaptureProof has been very, very successful in building out these types of asynchronous use cases, and they have multiple computer vision types of applications. You've got a company like PeerWell, who is talking about prehab and getting people in better shape prior to surgery and walking people through a bunch of different protocols that prepare them to actually have a better outcome on the other side. So this type of prehab and rehab now being done via smartphone. And then companies like Buddy Healthcare, who really navigate the entire surgery life cycle. But it's pretty incredible. And I think when I take a look at this computer range of motion analysis, or things like being able to do gait analysis and shoulder symmetry and track those things, I mean, it is a brave new world in terms of what the technology can do to help us treat patients remotely where they're most satisfied, where they feel safest, and save them travel time and all sorts of different things. The other thing, again, previously uncharted data. Telemedicine will give you the ability to track more data than you've ever tracked before, and now we can layer AI over conversations to track the metadata from that and do a lot more than we've ever been able to do before. Again, very, very exciting times from that prospect.
So quick thought on the data that you mentioned.
Yeah.
I think we run the risk of, we get a lot of data, we can be drowning in it. So
Correct.
how do we move from data to insights to actionable insights, so that because I do hear a lot of clinicians say, oh my gosh, like I'm inundated with it. So can you speak to, just real quickly on that, because obviously previously uncharted data, like, okay, so how do we make sense out of it and use that to drive how we provide care?
This is a long time big data challenge, right, Sean? I mean, I think it's an incredible question, because when I was an investment banker early in my career, someone would show me a spreadsheet, my eyes would glaze over because
Yeah.
you're like, well, there's a lot of data here, but what am I looking at and what's important? Now with the technology, you can actually surface data that's important to that specific clinical decision, and that can drive the insight, right? And the AI can then help drive what that insight is by coming up with pre-filters over if patients' pulse ox reach X, do Y.
Right.
And so it's about filtering that data down to something that's actually consumable by a human, so that we're not just showing people, 1,000 data points on one page, but really getting it down to those critical 3 or 4 that they need to make that decision. So we're constantly working on our reporting tools to make sure that that's exactly what we're doing. It's about taking data, creating an insight, taking an action off that insight, and then going back to what gets measured gets managed, measuring it and creating this feedback loop that is continually making that decision better.
Yeah, and I was just going to say, from the standpoint of where I've seen this work really well, is when you have data that actually surfaces up not only who needs to be seen, but when they need to be seen and why they need to be seen.
Right.
So we become much more efficient in how we deploy the limited resources that we have to take care of a very wide, a broad swath. I mean, if you've just had somebody come home from surgery, like, where are they in their progress and who needs to be spoken to today about what? And then it also allows us to target who needs to be doing the talking to them. So is this a surgeon call? Is this the nurse call? Is this the PT call? Is this pastoral care? It is really interesting how you can target what needs to be done and by whom.
Yeah, and also to whom, right? So a lot of times we direct.
Is it the caregiver? Is it the patient?
There you go.
Is it the adult parent? The adult child?
Yeah, why are we giving discharge instructions to a patient that just had heart surgery when they're not the one who's going to be performing anything post-care? It's going to be that caregiver. So being able to come up with telemedicine support for that caregiver and show them recorded videos of those discharge instructions so they can go back and revisit them. Because let's be honest, I'm talking fast now, but doctors sometimes are ready to move on to that next patient. So we give those discharge instructions, or the nurse does. It's like, great, you understand? And the patient's like, yeah.
Oh.
Sure,
like
I do.
You're caught in the headlights. Sure.
Sure, I do. And then they get home and they're like, oh, I don't remember what the doctor said about X, Y, and Z. So telemedicine, again, can help provide that support infrastructure, that caregiver needs to be successful. So, but an incredibly important point to whittle this data down to what's important. All right, so what is telemedicine? I mean, we refer to it as simply the new medicine. Again, I have a digital transformation slide coming up, but this is just the digital transformation of healthcare accelerated right now under COVID. And I think the interesting thing is there are so many benefits. You can, it's going to be integrated into how each specialty practices. It's cost effective, it's collaborative. It can be, it can shift to the changing demands of healthcare. It's measurable, it's simple and scalable. All these things are really going to support telemedicine, hopefully not being called telemedicine anymore and just be called, hey, it's medicine, but can we set up a video call?
Well, you make that point, but I keep asking people, when do we refer to it as teletravel, telebanking? So we don't, we're still in that telehealth. So we don't, it's just going to be health. And this is an integrated part of how the care continuum looks like, the patient journey, the provider journey.
Yeah, absolutely. And it's pretty amazing, right? We're starting to get so much better at design than we've ever been before. And you talked about those journeys, Shauna. Those were things that we really didn't think about. It was like, hey, we have this cool tech. How do we get it into people's hands? As opposed to being like, you know what? How do people actually do this? And how can we make the tech support what is that journey? And that's the mentality that a lot of companies have now is, look, we need to support the patient journey. We need to support the physician journey. And we're going to do that through design thinking. And we're going to, right?
Yeah, when you bring that up, I think another point is, you bring them out as discrete streams of activity. And at this point, with this collaboration tool, it doesn't need to be the nurse journey, the physical therapy, the surgeon journey, the outpatient experience. We can actually have a journey that is a coordinated care, where care coordination has been one of our biggest challenges. So this is a place where, this opportunity that we have, this moment where things have been thrust upon us and we've been forced to change, we actually get to redesign how we might like that system to work, learning from all the things where there were challenges, where there were deficits.
Yeah, and to that point, we've heard a lot of people, Shauna, talking about the fact that, the system needs to be more patient-centric, right? I hear patient centricity a lot. Patient centricity is really important, but so is provider centricity. So is X-ray tech centricity. So is, we need to treat these as one ecosystem as opposed to your point, different experiences. And I think those walls are really breaking down. We're starting to take a look at what is a holistic healthcare journey and what that means from the different stakeholders within it. And that is a much healthier approach to how things are currently getting done. So couldn't agree with you more. And there's so much waste in the system that something like telemedicine can help solve. How much time do we spend waiting in
parking? You show this big thing up here and I'm thinking about how much time people spend trying to get to and from the parking lot. So
yeah, parking, to and from, waiting rooms. In business school, they taught us that that's inventory, and that inventory is really waste and inefficiency. So I'm not going to talk about a human
unless,
being
of
that
course,
way
you
per
need a
se.
stockpile of face masks, at which point
Right. This brings up
it's not an either or, it's a both.
Right. And Shawnee, it's really interesting. So if you take a look at kind of what's happening in the country right now, like one guy's view is that we had this whole country set up on just-in-time inventory, and we thought that was the most efficient way to do it. And while we go through exercises at all of our healthcare facilities about how to prepare for a pandemic, no one ever thought it would be like this, right? Like, we don't know what we don't know. And I'm betting what we're going to see in the future is people's par values on ventilators and masks and gowns and visors all changing, and there will be stockpiles of this stuff around the country for the next time. So interesting things happening there.
So we have a lot of audience questions. Are we good to, have you shared what you wanted to share in the presentation so that I can grab some of these questions from the audience?
Yeah, you know what? Give me 2 more minutes to fly through some of these slides, and then
You're going to need to fly. So go.
I will fly. So one, telemedicine was already here. There are closed systems out there like Kaiser that were already doing north of 50% of their telemedicine consults, of their visits in telemedicine. That's an important point. People said that there were going to be a lot of challenges. How do we bill for it? People aren't that tech savvy. There's a lot of legal and regulatory issues. Well, clearly COVID has knocked that all out of the water. And the preferences side of it, like healthcare really preferenced the in-person visit, right? We put a lot of weight on that. And now we're putting a lot of weight on the telemedicine visit. So while that water was choppy, it can be navigated. And now this is about how you implement practical programs. And a lot of it, Shauna, rests on human behavior. It's not about the technology. Yeah. Right? It's about human behavior and our willingness to change that behavior. And I think COVID's provided a pretty incredible catalyst to that. And from a technology standpoint, let's not go for the sizzle. Let's go for things that are practical, because that's what's really going to be adopted quickly and be very intuitive for folks. Research has shown, and this just to your point, Shauna, before, research has shown that this is really effective. One, people tend to be more honest with some physical dysfunction. They're not fearing, there's no fear of being judged when you're in the room with the doctor.
Or shame.
Or shame about an STD or erectile dysfunction, whatever it might be. Like Roman has proven and built over $100 million business on the fact that there are some things we don't like to talk about in person, and that we're actually more honest with some sort of physical distance. And that distance doesn't need to be social distance. It can just be physical distance.
Yeah.
Patient satisfaction is equal to in-person care. Travel savings, the VA did this study on the fact that they saved 3.5% of their budget by not having to reimburse for travel savings, and so much more. So the research supports that telemedicine is a very effective way. We need to be thinking about return on these investments. And right now, by the way, we're offering our platform for free to market. So ROI isn't kind of a thought process.
It never gets any better than that price.
That's right. Nothing gets better than free. So
unless you want to pay me to use it,
Well, yeah, there you go. We're doing this type of stuff because it's the right thing to do, and the contribution to helping flatten the curve here is critically important. But we need supply chain.
Humanized healthcare.
There you go. But what we really need people to do is to ensure that hospitals are thinking about things in the right way, and not just thinking about cost savings, but thinking about value creation. So that's an important thing when it drives ROI. And these are how people need to be thinking about it. There are 3 main vectors in a hospital: efficiency, quality, and customer service. And you can go down and see what increased patient flow, less waste, and greater efficiency, better outcomes, mitigating risk, improving quality, creating raving fans of the healthcare system, and the fact that healthcare can be fun. I'll say it, telemedicine platforms can be fun to use. And when you make something fun and engaging, people are going to use it more. So a lot of benefits here to calculating what ROI is. And I'm happy to offline answer any more of these questions that might be about how you really construct a good ROI for your telemedicine platform. So what's the opportunity? It's to lower costs for patient, provider, and hospital. It's to match cost to acuity and eliminate waste. It's about providing the right care at the right time. Specifically with COVID, it's about reducing healthcare disparities. saving PP&E. And the one thing that's just environmentally people don't talk about is the fact that we can lower a lot of our carbon footprint in healthcare and decrease this $3.2 trillion of GDP that we spend on lowering and using telemedicine and everything that comes from using it. So COVID use cases have been on the rise. This is just an important piece to just understand how people are using telemedicine in a COVID world. One, telequarantine. So doing clinical distancing of our providers actually in hospital. It's not just about staying at home. It's about people not having to go into that COVID patient's room and treat them, and mitigating the number of people that need to do that from a care team standpoint. It's home virtual visits, it's tele-ICU, it's infectious disease specialty. But one of the things that people haven't really taken into account is these COVID patients are isolated. And can we do televisitation with their family members to make them feel more connected? These are the important things when it comes to humanizing healthcare that are key. So digital transformation is underway. There's a lot of exponential technologies that are out there that people really consider revolutionary that could be implemented right now, but right now people are really focused on what's revolutionary from an evolutionary standpoint. And a lot of these simple technologies that we already know how to use can be set up so that we can actually create revolutionary outcomes on the evolutionary tech. All right, how was that, Shauna?
Well, to your point, from the standpoint of is this fun doing it in a telephonic way or in video way? I'm having a great time. What about you?
I'm loving this. I'm loving this. Yeah. And by the way, I know we're on a time limit, but I could do this for hours.
Oh, I was gonna say, and you're good at it. And I think that this is another skill that we are learning, how to be present. So when you were talking about, we need to be physically distant, but virtually connected. We say, we're saying stay home, but let's say stay home and stay connected. And these are great tools and technologies. There's one question in particular that there's a lot of questions on. How does an orthopedic surgeon accomplish a legitimate physical exam on telemedicine? They want to know the tips and tricks. And before you answer that, I know Stefano has been talking about how he's been doing that with his clinic. So I'm going to invite Stefano to make sure that he puts something in the chat box to answer that. As the orthopedic surgeon, let's hear it from the telemedicine platform person, the guru who's humanizing healthcare that way. And then I want to hear from the surgeon. What he's been learning as far as how do you do those legitimate physical exams. And you've got 2 minutes to do it, and then we need to say goodbye.
Okay. So legitimate physical exams, there are a bunch of tools out there, whether they're from Massimo or a company like Capture Proof, that can help show you, again, degree inflection. You can take vitals remotely. There's a lot of different things that can be done. And Stefano, doing this for a living is going to give you probably some of the best answers. So I'd keep an eye on that chat. But, you can actually see an eye dilation over telemedicine. You can actually instruct the patient on what to do and say, could you touch does this hurt when you touch, your rib here? And so a lot of it is learning how to better communicate when you're not the one doing the work, when you need to have someone else in the room do the work. And in B2B, that's true too.
Surgeons and their communication skills?
Yeah. It's a new skill set that we all need to build. It's Shauna, you're the nurse in the room. Would you mind palpating here? Or if you're at home, patient, would you mind just apply a little pressure here? How does that feel? It's learning a new skill set that is communication driven. Yeah. And so that physical exam is still physical, but it's just not your hands. It takes some training and some experience.
Great. Well, this has been so much fun, but we were trying to be really helpful, and I feel like we've been really helpful. Jamey, Cloudbreak Health is just a great global citizen. So thank you for all of the work that you do. And you've got, I know it's not just Jamey, you've got a remarkable team, and I have such great love for so many of them. You're out in Los Angeles. You guys are starting to ramp up.
Yep.
Stay safe, hand washing, get extra hour of sleep, be good.
I will do that. I just want to remind everyone, don't give up the ship, right?
No,
this is not the time.
This. We got this.
We're going to navigate this. This is going to be big. Anyway. And thank you everyone for being on and listening. And if anyone wants to reach out to me out of band, feel free.
Okay. Well, thank you guys. I'm your host, Shauna Butler, and I'm looking forward to having you join us in other sessions. We're so grateful to DOCSF, for UCSF, for the American Society of Orthopedic Surgeons, and all of their joining us and to convene such a fabulous audience and such great talent in helping us respond to and rise to the occasion and the challenge of COVID-19. All right. See you guys soon.
Bye, everybody. Thanks, DOCSF.